This is Piotr Lodziński from Department of Cardiology from Medical University of Warsaw, Poland. Today, I will show you some tips and tricks with near field and far field potentials and its meaning for catheter manipulation and navigation inside the human heart.
Near-field potential represent local electrical activity that is observed in a neighborhood of the electrode. Far-field potentials represent electrical activity that is observed by electrode from some distance. On CS electrodes, you observe near field of atrial activity and a far field of ventricular activity.
This is an example of a coronary sinus catheter reading. You can nicely see both near field and far field potentials. How to differentiate which is far field, which is near field? I think it's important to observe the dynamics of and the behavior of the potential when you manipulate the catheters. General rule is that the closer to the cavity you are, the higher potentials from this cavity you can record. So generally, this CS catheter is placed in atrial vascular system. The distal portion of the catheter goes toward ventricular part of the vasculature. On the medial and the proximal rings, you can see far field potentials. They are not so sharp and not so high, with not so high amplitude. This is another example of far field and near field potentials. This time, CS decapolar catheter was placed in a superior part of tricuspid annulus. At the distal part of the catheter, you can see far field potential of the atrial activity, His potential, and ventricular potential, which is also a near field. You can nicely see that although both potentials have almost the same amplitude, we know this is a near field of the His bundle. This is a far field of the atrium. That may be confusing, but what I previously said, it is important to observe the behavior of the potentials during catheter manipulation. If you see large atrial potential on your catheter that is on tricuspid annulus and a small far field of the ventricle, it means you are too much on the atrial side. If you push the catheter, then you should observe change of the proportions. Higher amplitude of near field of the ventricular activity and a far field of the atrial activity. This is an example of practical use of differentiation between far field and near field potentials. This patient is after the isolation of the left pulmonary veins. We observe readings from multipolar catheter inside left superior pulmonary vein. And to differentiate whether it's near field or far field potential from the appendage, so near field of pulmonary vein potential or far field of left atrial appendage, we need to use pacing maneuvers. We pace from left atrial appendage, and then we observe the behavior of this potential. If it goes with delay inside the vein, it means that was a near field of pulmonary vein potential. As it disappears while we pace from left atrial appendage, it means that it was a far field reading of left atrial appendage potentials inside a left superior pulmonary vein. And by the way, you can also see far field potentials of ventricular activity inside left superior pulmonary vein. But this time, there is no doubt that this is a far field. The observations of near field and far field potential behavior during your catheter manipulation may help you to correct the position of the catheter to obtain, for example, a good ventricular capture during pacing. What you can see there is you have almost the same proportion of atrial and ventricular activity at the tricuspid annulus catheter placement. You can see small His bundle potential here. So when you pull back the catheter, you can observe the increase of amplitude of atrial activity, and ventricular activity becomes a far field potential. Whether you opposite, when you push the catheter deeper, you can see that ventricular potential is higher. So if you push a little bit more, then you'll probably get the capture of ventricle without capturing His bundle and stimulating both atria and ventricles. There are many practical aspects of observation of near field and far field potentials. If you want to navigate your CS catheter before transeptal puncture to have the best anatomical information about the place to puncture the septum, you should place your CS catheter in atrial vasculature system, which means that you should manipulate your catheter to have at the distal part of the catheter on the left heart silhouette with high amplitude near field of atrial activity and the small far field of ventricular activity. That position definitely will help you to puncture intraatrial septum in a best possible position. So, far field or near field? The answer very often comes with catheter manipulation. So, carefully observe the potentials and the behavior of the catheter during manipulation, and then you will be almost sure whether it's far field or near field. The knowledge of far field and near field is important for catheter placement, for proper catheter manipulation, and at the end, for the proper assessment whether you achieved the line of block or not. So, once again, usually far field is a small amplitude and not very sharp potential. The near field usually has a higher amplitude and a sharp shape. But at the end of the day, the differentiation comes with observation of the potential's behavior or using pacing maneuvers. Thank you for your attention.
For more hands-on training and interactive lifelike simulations, go to ep-simulator.com. Join the community of trainees and experts and start your course today. Pick up a level for you and get step-by-step tutorials. Hop on board. Log in and register for free to start your education as EP specialists. Enjoy straightforward educational materials and listen to experts sharing their practical experience. With this knowledge, you will master all the practical tasks that you face during simulations. Like in real life, you can adjust settings of the study and use different pacing maneuvers. Trace the heart response and make your diagnosis. This is the best way you learn EP.